The FDA is walking back on a positive Cyclospora test tied to lettuce supplied by Taylor Farms, now calling it a false positive. That reversal is raising new questions about how food safety testing actually works and how contamination can affect results and what investigators look for before linking a product to an outbreak. And joining us now is Dr. Jerry Lopez, an associate professor and food safety expert at the University of Arizona, who also serves on the FDA's Cyclospora task force. So Dr. Lopez, I think we came to the right guy for all these questions. Thanks so much for joining us this afternoon. I want to start with the obvious questions. So let's start with the reversal from the FDA. The FDA says its original finding did not show true amplification, was the term they use, and should be considered a false positive. Can you explain in layman's term what this means and how can a test appear to be positive if the parasite isn't actually there?
Sure. I mean, I think they're being cautious in all aspects. When you're testing for samples for Cyclospora and these type of samples, it's you either see that amplification, we refer to it as a CT value, and it's a threshold. And so I assume what might have happened is that there might have been at the cusp of that threshold. And so initially, yes, there is amplification there, but they might have decided to retest that just to make sure, just a second test of it. It could have then, because it was at the cusp, it might have not been detected the second time. Maybe that might have happened. Another thing that they could have done is decided, okay, you know what, we're going to now do DNA sequencing on this sample. And so they've done that. And again, sequencing is one of those things where there isn't a lot of DNA present, and they might have come across where there wasn't conclusive evidence to confirm that it was there.
Interesting. So, Dr. Lopez, when people hear the FDA first announced a positive test and is now saying it was a false positive, some quickly ask themselves, can we trust what's coming out, right? That's just natural inclination. What do you say to those people who are looking at this reversal and questioning the reliability of food safety testing and what's coming out here in these reports?
Okay, no, I mean, I think the apprehension and the confusion is there for a lot of us, myself included, being a consumer, right? But I think if you look at the traceback investigation, we cannot refute the fact that the investigation is definitely taking us that there's been over 5,000 cyclosporias cases. And so those samples that have been tested from the stool is confirmed to be cyclospora. So trying to go back now with the traceback investigation and determine what commodity was actually contaminated, that's where the real challenge, or another added challenge to this traceback investigation. So I think as consumers, we should say, you know what, I know that the FDA, CDC, industry, Taylor Farms, Taco Bell, everyone that's involved is really trying to put their best foot forward. And they're working together to try to determine what the culprit was, right? The implicated commodity. And so I think with time, we're going to see some confirmation come out. Many times in some of these outbreaks, we can't conclusively determine what the commodity was. And so I think let's just be patient. Let's be mindful that, yes, there has been an outbreak. There is a current outbreak going on, and that we should have our best practice at home when we're cleaning our food, washing it, our leafy greens, when we're going out to eat, what we're choosing to order. So it's definitely a personal choice there, but I think we could rest assured that the FDA, CDC, and everyone involved is doing their best to try to get ahead of this.
Dr. Lopez, you mentioned challenges, so I have to ask you this. The FDA had previously paused part of its lab proficiency testing after staffing cuts, including an exercise involving Cyclospora. So is that something that we should be thinking about here, or is it simply too soon, do you think, to connect those staffing cuts to what happened? Because there's a lot of chatter about this, especially on social media and in regards to all this reporting.
Yeah, no. Now, in terms of the staffing that is there, the staff that remained, besides the cuts that were made, I mean, they're definitely dependable, responsible, well-trained individuals, right? Now, there is experience that results from being part of that agency, the depth of the knowledge over years, of having or experiencing these task force or the outbreaks that have occurred year after year, not as bad as this one. But I mean, it's just like everything, right? When there's a staffing decrease in any type of agency or program, there is extra work there that's added on to the individuals. And so we're hoping that, I know they're doing the best they can. They have some great people working there throughout these agencies, and rest assured they're gonna hopefully be able to get to the bottom of it, of what was involved.
Well, let me ask you this. What would you need to see, based on your experience in all of this, what would you need to see before you could responsibly say that staffing reductions played a role in this?
Well, the traceback investigation is really challenging all of in itself. That when you think about it, the time it takes to perform these interviews, to go ahead and go to the people's homes or via Zoom or phone call, if you only have 10 staff versus 25, that's going to take much longer, right? I think we want to have answers now when we look at the perspective of the testing. But when you think about it, the commodities that were on the shelves or the ingredients that were used, that could have been a month ago, 3 weeks ago, that were actually utilized. They're no longer in on the shelves. So it really complicates it. When you look at doing testing at the farm level, same situation there. That commodity has been out already 3 to 6 weeks prior, 3 to 4 weeks prior. To be able to find a package that was actually had the contamination is going to be challenging.
Yeah, a lot of challenges ahead, and you can understand why consumers are so frustrated, confused, and asking a lot of questions. So
Sure.
basically, what does this mean for consumers right now? Should people still avoid the recalled lettuce? I know you mentioned taking extra precautions with food safety, and we've talked about the fact that this is not anything new, that there is also antibiotics. You just have to go get tested. So what's the big message that you want viewers to take away from this?
I think the main idea is that if they start experiencing symptoms, go get tested. We know there's an outbreak. Why wait a week? The sooner you can go ahead and get tested and determine if it's Cyclospora, the easier it's going to go ahead and help us with the traceback investigation. If you're with your grocery receipts, you're eating out, take pictures of your receipts, your food, so that way that will also assist in the traceback investigation if you start experiencing symptoms. And again, the main thing is to be confident with the food that you're buying. We know that either grilling or heating up, cooking your fruit, your vegetables, excuse me, is the best way to go. Do that if you can with your leafy greens. If you're having a salad of some sort, make sure that you wash it really good and go through those precautionary steps, right, to make sure your food is safe.
Okay, really good insight and sound advice there, Dr. Jerry Lopez. We really appreciate your time. Thank you so much, sir.
Thank you for having me.
Of course.